It is great to be here with this amazing panel, and I think what we're going to try to talk about in kind of quick order is how philanthropy and systems have worked to get us to this moment, as well as what's left to do. I think we've heard about some of this progress, both nationally and locally, and at the community level. But I think the biggest question that we have to answer collectively is, how do we truly understand it? And I appreciate how Greg and Adam kind of talked us through some of these ideas, but we have to understand it, we have to sustain it, and we have to explain it. We got to make sure people, as they're feeling these changes, are able to understand what brought us here. And so we're going to talk about sustaining progress over time, but first take a quick look backwards. And Nancy, I want to start with you because across the nation, as we heard, and Jeff kind of showed us the data, we are seeing historic reductions. And we're seeing them with mass shootings, we're seeing them with assaults, and with community violence. And that's meaningful. And I think, as we just heard in the last panel, community violence intervention has played a significant role like it had never played before. And I hope you could tell our audience, what role did philanthropy play in supporting that? Because we heard kind of about the system change, but I don't think the story is as simple as we just had system change. And so can you just walk us through how you thought about and lived through seeding the ground for the work?
Sure. So I'll talk a bit about just sort of how I think philanthropy has been useful. And I'll be interested to hear from the people who are actually doing the hard work, if I'm right. So I've got 5 things. So the first is being the first one in, right? Supporting innovation, which I think philanthropy in general can be pretty good at, and doing so in a way that invites system players in. In other words, makes it okay and acceptable for government to kind of follow along and also invest, and also, hospitals and also business. So I think, there's some great examples at the local level. In Chicago, the Partnership for Safe and Peaceful Communities, incredible collaboration of funders, also brought in businesses and worked with government. In Baltimore, support from the Annie Casey and others in that work. In Detroit, the Michigan Justice Fund, the Joyce Foundation, Ford, and others have kind of helped seed that work and brought government in, because it is public safety is a public responsibility, and it ought to be part of public systems. And at the federal level, I would point out, before there was a Bipartisan Safer Communities Act, before there was an Office of Gun Violence Prevention, there was a Community Violence Intervention Collaborative in which 13 national foundations joined with the White House and invested in the CVI ecosystems in 16 cities, including, supporting technical assistance and grants to nonprofits and a process evaluation. So that's one area. The second, I would say, is field building, what I would generally classify as field building. So making sure that leaders who have expertise and experience also have the time, space, and resources to do strategy development, to innovate, to network, to share knowledge, and to collaborate. I think that's often, sort of underinvested. And I think about the amazing work of the CVI Action Plan, which really lays out a pathway forward for the CVI field, and the Coalition to Advance Public Safety, a little close to my heart, which brought together 4 leading CVI organizations to work in cities around the country. Those kinds of innovations. I would also put in here training and technical assistance, leadership development, leadership pipeline development. So that's 2. Third is research. We've talked a lot about research and its importance. I think philanthropy has jumped into places where the government has not been there or has left. Fourth is communications and advocacy, which is just not often supported by government. Communications, you saw what the Ad Council is doing, making sure that people know and understand, to your point, Rob, what has happened. Both that violence has gone down, because I tell you, I talk to people who are not in this field, and I say, do you know that violence is down dramatically? And they're like, really? I didn't know that. So I think making sure people know that and know why. And the other thing is making sure that people can go to their policymakers and educate them on this work and why it matters and that they should fund it. And the last thing I'll say, which became really relevant last year when the DOJ cut $500 million in funding, is that emergency and rapid response work. We're not as good as we should be in philanthropy and moving dollars that quickly. But I think being able to support litigation, being able to do some last mile funding for research that was left hanging, support for groups that were expecting money to come in and were about to lay people off. I think that was helpful. It was not as big as it should have been.
Thank you, Nancy. And I think what's important is those were all things that philanthropy did to help us get there.
Yeah.
I mean, that wasn't just theory.
Yeah.
That is history.
Yeah.
And I think that is what's important to know is the hard work by our leaders on the ground, our leaders in the movement, but in philanthropy supporting them, that gets us to system change.
Yeah.
Alastair, I think the last panel was great because Ruth literally was singing your praises. And so want to ask a question about how we see many initiatives start off strong, but fade over time. And I think the recent research we heard about didn't just celebrate the success you've seen, but it's the long-standing success. And I understand that it's not a small endeavor because your hospital sees 70% of gunshot wounds in Boston. So you are truly at the front lines. And I would love if you could talk about how the system and how you think about sustaining the work over time to make sure that you are consistently delivering these results.
Yes, so I think it comes down to focus, framing the question broadly, getting at root causes, and ultimately being dissatisfied. So Boston Medical Center health system, actually, so we are the largest central healthcare system in the Northeast in New England. About half of our patients are on the Medicaid program. We also insure 40% of all of the patients in Massachusetts. So we have a pretty large role in both payment and delivery of care to lower income populations. And so this is a very real kind of issue for us. And when you think about sustainability, Boston has had actually a lot of lessons in both being sustainable, like more recently, and not actually. So, if you really dial back, rewind the clock, Operation Ceasefire in the mid-90s saw a pretty dramatic decline from very high levels of gun violence. That got to very low levels relatively. But then sort of within 5-6 years, we were right back, actually. And it was around that sort of 2005, 2006 timeframe that the VIAP program was started, and which Ruth in the prior panel described so well. I think the interesting thing about the VIAP program, beyond now that we've looked at its long-term impacts on re-victimization, continued involvement in violence, is what it actually does. It helps people with housing. It helps people with pathways into employment. It helps people with actually the root causes of often why they were involved or kind of in a position where they might be involved with gun violence. And so, again, sort of focusing on those root causes. And then I think probably that the last thing I would say just is on being dissatisfied. Boston at the moment is, I think 2024 was the lowest number of homicides in Boston's history. I'll just note that is still 2 to 4 times the rate of homicides of major cities in most industrialized countries. Mm-hmm. And so while we can celebrate the progress of getting there, you can also say, hey, that 24 murders in 2024 are actually still too many, and that is still too pervasive. But to get at it and sustain the progress, we have to be getting at the root drivers of why that's happening in our communities. And VIAP is just one of a number of things in Boston that kind of goes after that.
Thank you, and it's a good reminder that the progress is not the reason to stop, it's just proof of the solutions that we have to double down on. Mm-hmm. And so I appreciate how you kind of talked about the commitment of a system to being in that space. And John, I think this panel is important because we can't just talk about the successes. We have to talk about some of the work that is significant and left to do. And I appreciate the panel that Megan and Rob were on, that they kind of really leaned into suicide and suicide prevention, because I think, as some people have said, but I'm going to say again, like with these reductions, which are significant, we also have to sit with the fact that 2025 will likely have the highest number of firearm suicides in history. There is a lot of work left to do. And John, you were one of the leaders, organizations and individuals, of thinking about how to bend that curve, especially when it comes to youth. And can you talk to us about how philanthropy and JED is thinking about investing in this work and investing in the solutions?
Yes, thank you. But just quickly, the JED Foundation is a nonprofit that focuses on teen and young adult suicide prevention and mental health. And we do a lot of that work in youth-serving boundary communities, school systems, individual schools, community-based organizations, looking at everything they can do to increase protective factors and reduce risk factors. What we've seen from philanthropy, first, philanthropy has really invested a lot more in mental health and suicide prevention over the last several years. I think we could use a lot more philanthropy and support, but there has been a significant increase. And we're seeing great things from philanthropy, supporting the Fund for a Safer Future, supporting Agree to Agree, Ad Council, all the examples that Nancy gave. What I'd say, though, is in suicide prevention, when we think about this, it's really about a comprehensive approach. It's about creating a culture of caring in our communities and our organizations, beloved communities, as described earlier. And so it's about making sure that young people have life skills and social emotional skills and problem solving skills, that they feel connected and like they belong and not isolated, that the stigma is reduced and the other attitudinal behavioral barriers are reduced, that our systems are set up to notice when a young person's in distress and needs help, and then connects them to the right kind of care, and then manages that we know how to handle a crisis. And then the final domain is lethal means safety. Right? And as described earlier, suicide can be very impulsive. The impulses can be fleeting, so time and distance, as Rob described earlier, is incredibly important. And this is fundamental to suicide prevention. And there are programs at work, like counseling for access to lethal means, that needs to be scaled and needs more funding, safe storage, et cetera. But what I would say is a call to action for philanthropy, and I think if this is starting, but I would argue that there should be no mental health initiative that does not purposefully have suicide prevention as part of it. And whether that's from philanthropy, or that's in a community, or that's from a nonprofit, a mental health initiative is incomplete if it does not purposefully include suicide prevention. And a suicide prevention effort is incomplete if it does not include means safety and lethal means safety and firearm safety. So we're all part of the same system here. And I think if we can bring that mindset together, so that there's more cooperation and it's not siloed, that could be very, very powerful. And philanthropy is positioned, probably like no other, to sort of make that happen, help convene that, and put that expectation on the organizations and the actors that are dependent on philanthropy.
And you said it very nicely, but I'll say it more directly. Like, in recent years, we've seen some increased investment, but we really have to accelerate.
We need a lot more.
And
yes.
I think that's one, and two, and I really appreciate the earlier panel, it can't be an either or. It is not mental health or lethal means. It is both. And I think that was some of the work we tried to do